When you travel, there are many things you do to prepare for your trip. But does that list include preparing for health and safety concerns at your destination? It should, and here to tell us why is Dr. Mary Louise Scully. Dr. Scully is an infectious disease specialist and director of the Travel and Tropical Medicine Center for Sansum Clinic. Dr. Scully, why should we prepare for health and safety concerns when traveling abroad?
We should prepare for health and safety concerns when traveling because now we're lucky enough to be able to prevent many infectious diseases rather than having the traveler get sick during their trip. Good examples might be hepatitis A vaccine. Another one would be malaria prevention pills. And all of these are even appropriate for the last-minute traveler. Sometimes with business travelers, they're asked on very short notice to make a trip maybe to India or Indonesia or China. And even on short notice, these interventions are useful to prevent illness. There's a lot of misunderstanding about vaccines in terms of what's required versus what's recommended. There's very few vaccines that are required. The exception would be yellow fever vaccine, but there's many that are recommended, the point being to help keep travelers safe. We all love to travel, we wait for our vacations, and we wouldn't want even one day or two to be lost on illness during a trip that could have been prevented beforehand.
So, what are some simple things we can do to stay healthy when traveling?
Some really simple things to stay healthy during travel is good hand hygiene. Namely, just washing your hands with soap and water. Sounds really basic, but it works. Another really simple intervention is getting your flu shot, influenza vaccine. I feel like this is really important for international travelers, especially when we spend long hours in the confined space of the plane with our traveling companions who may be sniffing or coughing next to us. And so I think that's a really important intervention. Another aspect during food and water safety, there's a travel health mantra that goes, boil it, cook it, peel it, or forget it. Obviously, that's easier said than done sometimes, but if you can follow some of those basic rules in terms of food choices, you're going to be more apt to stay healthy during your trip.
How does Sansum Clinic help travelers who encounter issues while traveling?
During a travel visit, in addition to preventative vaccines and medications, I like to hear the specifics of the patient's itinerary. That way I can sort of predict what problems might come up. Good example would be if a traveler is going to Peru, they're going to hike the Inca Trail, I'm going to want to spend time talking about altitude illness and also give medications that would prevent or treat altitude illness should they become sick. Another good example under food and water precautions is we usually send a traveler off with the just-in-case medication in case they come down with severe traveler's diarrhea or perhaps are in an area where they can't access medical care. So I feel like by going over these issues, the traveler has the medications, is better prepared for things they might encounter on their trip. In addition, being an infectious disease physician and a tropical medicine expert, I feel comfortable diagnosing as well as treating any tropical diseases that a traveler might come back with. Of course, our goal is to prevent the infections, but if they do get sick, we're ready to treat them as well.
This has been some great advice. Dr. Scully, thanks for joining us. Learn what you can do to stay healthy while traveling at sansumclinic.org.